of the questions that should be answered in an organization's risk or disaster management plan. Telling employees to get checkups and to lead healthier lifestyles is something every business and organization to do. Getting people to comply is another thing. Health communication research suggests some important principles that seem to work. Here are some tips for successful health communication campaigns. First, send credible messages. Telling people that they will immediately die if they fail to wear a seatbelt or if they eat fatty foods does not comport with people's experience. Many drivers who never wore a seatbelt are still around. Many people who eat cheeseburgers and fried potatoes feel just fine. Overblown claims and excessive warnings are counterproductive and undermine future messages. Clear, honest information is better than hyperbole. Next, suggest behaviors that work. Make sure that you're providing accurate information. Telling people to run during an earthquake is a bad idea, however reasonable it sounds. Getting under a heavy object is much better advice. Staying indoors to protect against skin cancer is not a practical suggestion for most people, especially outdoor workers and sports enthusiasts. Nor is it even good medical advice. Working and playing outdoors is associated with fitness and a healthy lifestyle. But wearing a hat and sunscreen lotion is something people can do, and it's quite effective in preventing sun damage. Next, we should make sure that people can comply with our recommendations. Telling poor people to purchase expensive supplements or to see their doctor is often impractical advice. These are things they cannot afford. Telling people to avoid public places where infections can spread is similarly impossible. Telling smokers to quit when they are addicted to nicotine is not going to get many of them to stop. Selecting behavior that people are able to do, such as eating more vegetables, wearing a hat in the sun, washing their hands before eating, or getting some simple exercise like walking, are things that virtually anyone can do. Create simple messages. For example, in our Sun Safety campaign, every message, whether it is a poster, a brochure, a training session, or an email, ends with 3 simple recommendations for outdoor workers. Wear sunscreen, sunglasses, and a hat. In Australia, the Slip, Slap, Slop campaign similarly emphasized a simple message. Slip on a shirt, slap on a hat, slop on some sunscreen. Most people do not need complex epidemiological information. They need simple, effective information of things they can really do. And most importantly, don't overdo fear. When you scare people too much, they avoid the message, not the danger. While fear can be effective, it also causes people to avoid reading and avoid remembering the message. Showing pictures of cancer victims is less effective than telling people the facts. Slogans can work. For example, sun's mean, wear screen. And humor can work too. Mix humor with fear. Fear appeals can be softened with humor. We've designed posters making fun of the raccoon look that people get when they wear sunglasses or goggles. Many people think it's a status symbol to come home for a beach or a ski vacation with the raccoon look. Our poster urges people not to be roadkill, implying with humor that sunburns can be deadly. Work on what is meaningful to people. Getting young workers to lose weight to look good is much more likely to happen than getting them to lose weight in order to prevent heart disease 30 years from now. Teens are more worried about smoking causing bad breath than causing lung cancer. Young women are more worried about wrinkled, sun-damaged skin than they are about getting melanoma. Getting people to do the right thing for a seemingly trivial reason is fine. Preventing unhealthy behaviors is an important goal, however it is achieved. Appeal to the safety of loved ones. Research suggests that we are more likely to take action to protect a loved one than to protect ourselves. Anti-smoking campaigns can be more effective when targeted at promoting the health of a person's children or their fetus than when targeted at improving their own health. Appealing to pregnant mothers to stop drinking alcohol to prevent fetal alcohol syndrome can be very effective. Getting parents to put kids in a bicycle or ski helmet not only protects the child, the parent is more likely to wear a helmet too. Appealing to parents to buckle up their child's seatbelt not only helps the child, it makes the parents more likely to wear a seatbelt too. Advertisement targeted at loved ones are extremely effective. In using health communication, two-sided messages can also be very effective. Most people do not like propaganda or biased messages, and people respond more favorably to a two-sided message than a one-sided message. Moreover, telling someone both sides of the story makes them more resistant to anti-health messages. A one-sided message that tells a child not to smoke or use drugs because they are harmful or addictive may be effective, but a two-sided message that admits that people feel drugs or alcohol make people feel good or feel good temporarily, but that the quick high is not worth the accompanying addiction, legal problems, or severe health problems is more effective. Dozens of studies show that two-sided messages work better, and they have another benefit. A person that uses a two-sided message gains credibility, so they have more power to persuade the next time around. Finally, spread the word. Most of us believe the mass media is all-powerful. In truth, we are more likely to be persuaded by a friend, a relative, or a coworker. Getting people to talk to their kids, their friends, and their coworkers about healthful habits and disease prevention is powerful stuff. And it is much cheaper than buying television time or even printing posters. If each worker in your company talked to one other worker about adopting a healthier lifestyle, the results would be dramatic. It is a well-known fact that good health habits should be taught as early as possible. Health education courses should be mandatory, beginning at primary education level. Furthermore, the subjects of health education and health communication should be a mandatory part of most curricula at the university level, as well as a part of corporate training programs around the world. An organization that does not make health and health communication a priority will not be able to compete effectively in the future. Well, I've given you some background as to the need for organizational health care management and for more effective health communication strategies with the goal of increasing our productivity and effectiveness. During the next module, I will talk to specialists with respect to the issues of today's most widespread and deadly infectious diseases and the threat of biological terrorism. And we'll discuss what we can do as far as preventive measures are concerned in these areas. A little bit later, we'll speak to an entrepreneur whose company specializes in making health communication more effective through the use of the latest technological innovations. For now, I look forward to your questions.
Let's begin with the first question and answer session. We will try to answer as many questions as possible. Therefore, we ask that only one question be asked per phone call and that these questions be asked as brief as possible. You may call the studio directly at the phone numbers or fax which appear on your screen. We remind you to make your phone calls at a distance from the monitor to avoid feedback. The first question actually is from Puebla. Go ahead, please.
Buenos días, sí. Hello, I'm calling from the official school. This is Licenciado Benito Juárez from Puebla. And I would like to establish a question in relation to this third video conference. The question is the following. What are the challenges that the countries should face, that is, developing countries, in relation to the health risks and also in relation to the increasing number of diseases that are fatal? That is the question.
Okay. Any special consideration to developing countries?
Well, obviously, good immunization programs, good, safe water, protection of the food supply, those things are extraordinarily important in the third world. But we have some infectious disease specialists here that probably can tell you even more about that.
One of the most basic fundamentals is the healthcare infrastructure and the ability to be tied into a communication network worldwide, such as the WHO or the CDC, or in Mexico, the local health authorities, so that if a disease outbreak occurs, the information can be disseminated rather widely. That even in the developing world, that is still a principal tenet of infectious diseases.
I would definitely agree with that and say that it's very important for not only communication to go to the WHO and other countries, but also the other way around, that we have people to communicate down to the general public in developing countries. And as Peter had said, clean water is a major issue.
Yeah, in fact, I installed a system last February in Pinon, Haiti, that links Pinon via satellite to the U.S. Internet and then to surgeons in Minnesota, Fairfax Hospital, and Washington, D.C. And that's been very effective in training, actually, in both directions. The doctors and the clinicians can relay their problems and their issues to the folks in the U.S. and vice versa, and the training goes back.
Yeah, it's really a two-pronged issue. One is getting excellent medical care delivered to individuals, but it's also having individuals learn to take responsibility for their own health and engage in healthy practices, as we talked about earlier. Not smoking, hand washing, a simple but important thing.
Okay. For the next question, we go to Hidalgo, Mexico. Go ahead, please.
Question is, what would be the human prevention in terms of healthcare? What can we do in terms of prevention? And also, how much funds should we allocate to these campaigns?
Okay, that was a two-part question.
Well, as far as funding to campaigns, it depends on the campaign. Some work better than others. And when you're dealing with a developing country, you have to look at what is the media that can reach people the widest. So in some areas in Africa, a lot of times they use radio because that's so widely used. Also, simple campaigns don't seem to do as well as educating people, giving them information.
I agree that education is definitely one of the most important places where you can spend your money, and certainly in prevention programs that's a very large factor. For example, now with the worldwide AIDS pandemic, many countries are getting money to treat people with antiretroviral drugs, and that money is targeted for these antiretroviral drugs. But people are overlooking, especially the funders are often overlooking that the basic healthcare infrastructures of these countries is somewhat lacking, and that money first needs to be put into basic healthcare before it can be used in specialized programs such as antiretroviral therapy. Otherwise, you'll have a failure in just using the money for antiretroviral therapy.
All right. For the next question, we go to Puebla. Go ahead, please.
Good morning. I'm calling from the Normal Carlos Duran in Puebla. And my question has to do with the subject of health education. What does the speaker has to say about not only talking about health prevention on the physical level, but also talking about mental health? And this has a great impact in addictive behaviors. Thank you very much.
Well, that's extraordinarily important, and we've often thought of mind and body as a dichotomy, but they are so interrelated, they're inseparable. And, of course, good mental health is extremely important. There's lots of research that close friends and family in a supportive mental health network, just informally, is extraordinarily beneficial to people. And, of course, when that doesn't work, getting professional counseling of one sort or another is extremely important. There's a lot of evidence that depression and anxiety are precursors of many physical diseases. So these two things are highly interrelated.
I would also say that within communities, there's something that we haven't talked about. We've sort of talked about individuals' health, and I think you need health of communities, and that's a sort of what I would call social or maybe mental health, where communities can take care of each other and organize. And in some developing countries, you see infectious disease situations or other sort of maladies such as smoking, cancer, issues like that, that are dealt with a lot better. For example, in developing countries where communities are tighter, they have a much more family, community-oriented type of situation. They do a lot better in that regard.
Okay. Our next question is from Sinaloa, Mexico. Go ahead, please.
Good morning. On the university level, and especially in countries in Latin America, what would be the difficulties that we would have to face in terms of health prevention on the university level?
Higher education?
Yes, well, obviously, issues of smoking, of drug abuse, of sexually transmitted diseases are very predominant in a college-age population. In general, college students are pretty healthy, but they also tend to suffer from feelings of invulnerability, and so they're at great risk also for automobile accidents and contracting HIV. So these are things that are preventable.
Thank you for your questions. Let's now move to the second module of our program.
Welcome, Lydia Drumright and Ramsey Asfour. Thanks for being with us today. We've been talking about the need to increase the quality of our health communication in order to increase our productivity. Let's back up a bit and explain to our audience what some of the specific threats are. First, Ms. Drumright, could you explain to us what some of the most serious infectious diseases in the world are today?
Yes, the ones that I would say were most serious would be influenza, which affects, on average, 3 to 5 million people worldwide, resulting in 500,000 deaths. Tuberculosis, which is a major increasing problem in the world today. Malaria, which affects over 3 million people in the world and kills 1 million annually. Hepatitis C, where there's 170 million people infected worldwide, which is 3% of the world's population. And HIV, which, as we all know, is a major problem, even though less people are infected, only about 40 million worldwide, but the case fatality rate or deaths due to it are very high.
Now, a lot of people think that influenza, is a pretty garden variety disease, not that life-threatening, but it really is a life-threatening disease, isn't it?
Yes, it is. One thing that we often regard as normal is sort of influenza, but there are a number of outbreaks each year. Every year, annually, about 500,000 people die.
Wow.
And when we have a new strain, as we did with the influenza pandemic of 1918, there were 40 million deaths,
Wow.
and that's primarily to the healthy population.
Yeah. And what about diseases that have made headlines in recent years, such as SARS, West Nile virus, and foodborne diseases such as mad cow disease and bird flu? What's the general consensus on our susceptibility to these bacteriological strains that have caused illness?
Well, I think that each of the new emerging infectious diseases is a problem. It indicates to us that there will always be emerging infectious diseases. Some of them will be worse as far as death rate.
But although these cause a lot of paranoia, are they as serious as flu and HIV and malaria that have been around for a long time?
Well, I would say currently right now, no. For example, with mad cow disease, very few people are affected.
Right.
With SARS, it's hard to say if it's our communication and our control of it, or that it's just not quite as fatal as influenza.
And how can we protect ourselves through improved communication and other preventive measures from contracting these diseases?
I think that one thing that's very crucial is to see communication as a worldwide issue. In regard to infectious diseases, I think we're a worldwide community. Diseases get on planes and they go places.
They know no borders.
They know no borders, that's correct.
Dr. Osfor, in recent years, we've seen terrorism becoming more widespread and coming to the United States for the first time as a means of making political statements. As a medical doctor specializing in infectious diseases, what are some of the biological weapons that you've been trained for, and what is the likelihood of these weapons ever being used on a large scale?
I mean, in terms of biological agents, when you're talking about bioterrorism, anthrax certainly has been used in this country recently, and that's the one that comes to most people's mind. We're definitely worried about the plague as well, as there was that's a common agent. It has been used, for example, by the Japanese during World War II. They dropped plague-infested fleas all over different areas of China, causing small outbreaks. Another disease we're really worried about is smallpox, definitely, as there's no effective treatment for smallpox. So, going back to anthrax, I mean, this is certainly a very big concern, as we can see in the recent epidemic. We don't even know who the perpetrators are of those crimes around the D.C. area and on the East Coast.
Now, California and some other states have some sort of bioterrorism preparedness plan that's now in place. And what are some of the details of that plan, and how can organizations apply this throughout the world?
Well, recently, especially since the anthrax outbreak, we've certainly been focusing a lot on bioterrorism preparedness. And so the plan is a multifaceted plan that occurs at the federal, state, local, and hospital level. So each hospital has formulated a plan under the guidelines developed by the state of California, for example, and also the county health departments. And the way the plan works is that an outbreak might be suspected, and it's really the frontline civilian employees of the hospitals that are responsible for detecting the outbreak.
And what steps should be taken among these first responders and health centers and facilities to respond to risk situations, including terrorism?
First of all, an education of the employees to recognize this outbreak. For example, an anthrax outbreak occurring in San Diego, California, might not be recognized initially because the bacteria that causes the disease might be mistaken for a common contaminant at first. So education is the primary aspect that has to be instituted. And then recognition and then communication is paramount afterwards, to alert the regional hospitals, to alert the FBI to conduct an investigation.
So it's very important for people in medical facilities, if they see an outbreak, to communicate that as quickly as possible.
Absolutely. Absolutely.
Well, very interesting. And what should people in the community know about accessing services or following media instructions in times of crisis? What does the average person do?
Well, the average person, especially if they're feeling well, they don't have any symptoms, and they weren't directly near the area that is reported as the major focus of the terrorism event, they should remain calm, and they should follow any instructions from the local health departments that are given to them. In terms of if patients or if people are affected and they're developing some of the symptoms, then they need to report to one of the nearest triage centers that should be set up as part of the emergency response plan.
And people should stay indoors if there's a bioterrorist attack?
Generally, people should stay indoors and close their windows, turn off any air conditioning that might be bringing air from the outside potentially, as the filters might not filter out harmful agents. But if they're not anywhere in the region where the attack is suspected to have occurred, they should really just go about their daily activities and follow instructions.
Good advice. Now, moving back to communication, do you feel that network communication between health centers and facilities is adequate today in the United States and, say, throughout the Americas?
The state of California conducted a survey of different hospital centers to find out how effective communications were. And they found a lot of areas that were in need of improved communications, and certainly the Internet is of paramount importance in this, in rapidly disseminating information. So they have provided a budget to different medical centers to improve their Internet-based communications.
Got it. And are educational institutions and corporations linked appropriately to health facilities with secure and redundant communication systems in place in a time of crisis?
I think that these systems are starting to become, starting to be used, and they're not fully in place yet. But there is some money coming to help fund that, and many more disaster preparedness drills need to be conducted so that we can ensure that our system works effectively with an appropriate level of redundancy.
Sure. And people in other countries, is each government throughout, say, the Americas developing their own plan to connect companies to government and provide an appropriate response?
Some countries have gone a long way in developing a response and in forging an alliance between different sectors of the government and the civilian society. But there's a lot of work that needs to be done in developing countries. During the SARS outbreak, which, for example, infectious disease outbreaks should not be treated that much differently from bioterrorist events, because they are, in essence, disease outbreaks, and you need some of the same levels of communication and investigation in both.
That's a very interesting point. In fact, what a lot of people, and what I hear you saying, is that natural disasters and terrorist attacks have a lot in common, whether it's an earthquake and a bombing or a natural outbreak of a disease versus introduction of smallpox into a population. So being prepared for one is really being prepared for the other?
Exactly. Both mechanisms are interrelated. The only additional response, for example, a natural disaster, you wouldn't notify the FBI.
Right. Lydia, do you want to react to that?
Yeah, I would absolutely agree with that. And following up on what Dr. Asfour had said, I believe that the issue really is that we sort of have allowed the developing countries to stay impoverished. And I think that without good health communication from those countries, we're going to see more epidemics. Currently, right now, the World Health Organization and the Centers for Disease Control are responsible for a lot of surveillance, even though those countries are trying very hard.
Now, I understand the CDC is putting a monitoring system in place. Do you want to tell us about that?
Yes, the CDC is trying to create what we would call a real-time surveillance system. Currently, it's a lot of paper pushing right now. Information goes from physicians to the county to the state to the CDC. And what they're trying to do is get that more activated with modern technology so that they can get real-time information and identify outbreaks more rapidly. This would help with bioterrorism as well.
Sounds valuable. And are they doing this in the United States and elsewhere, Ramsey?
They're doing it all over the world. The CDC has a presence in many countries, but not all countries, and the WHO is collaborating in real-time surveillance of data. For example, in Ethiopia, I happened to be there during the SARS outbreak, and they had a lot of information about SARS, and we're trying to get ready just in case they had a patient in Ethiopia, for example, with having SARS.
Well, diseases don't recognize borders, and it sounds like these are valuable efforts.
I think so. I think they really are.
Some diseases like smallpox were basically eradicated, 20 or 30 years ago, or for all practical purposes eradicated. And now we're at risk again. Why? Because people aren't being immunized, or what's the story?
Currently, nobody is immunized for smallpox, or nobody, or very few people have effective immunization. Those of us born before 1972, in this country anyway, were immunized routinely,
Right.
but the immunity wanes after